Health equity and inclusion, as we're known now. We've been here as a formal portfolio for the last 8 years. William Osler Health System falls into what is called the Central West Local Health Integration Network. We have over 50% of our population in the Central West LIN that are visible minorities from all over the world. We have a large South Asian community here, we have a large Black community here as well, and we have a large number of new immigrants who are settling in the LIN from all over the world. From a patient perspective, it's absolutely crucial that our staff and physicians are fully aware of what the needs are, not only from a clinical lens, but from a non-clinical lens in every which way. The same applies to employees. 99.9%, if not 100% of all our teams at Osler are diverse. And I'm talking race, ethnicity. It could be from an LGBT, lesbian, gay perspective or low-income populations. And most of the time, everybody respects each other in most organizations, including ours. Some of the time, there can be challenges. A person's diversity can impact the outcome, the experience for the individual as well as for the system in many ways. I have a small team. I have a strategic framework, very well supported by our senior leadership team. I focus on a lot of things, but mainly 4 different prongs that I can speak to. One is education and training. The other focuses on research. The third prong is around clinical and community partnerships. The last one that I'll speak to is the data and demographic collection. Not only do we have the formal portfolio, but we also have what are called diversity champions, health equity champions, ambassadors throughout the organization.
Particularly for a healthcare organization, high focus on diversity is very important in today's environment, because you can only provide service to a patient if you understand them, if you are there, if you respect their needs, if you support what they want.
We serve a very diverse and vulnerable population. Almost 50% of our patient population does not speak English or French as their mother language. 57% of our population is foreign-born, which is a greater number than the GTA. We have 8 neighborhoods in Scarborough that are identified as neighborhood improvement areas by the City of Toronto and United Way. 77% of our population identify with some religious affiliation. We also have a very diverse ethno-cultural population. Almost 70% of our population represents South Asian, Asian, Caribbean, Black populations. So really that demonstrates the breadth and depth of diversity within Scarborough. Our hospital's vision is to be a leader in Canada and serving a global community. So because it's embedded in our vision, it needs to be embedded in everything we do. And we really have it focused in 3 main areas. How we focus on our patients. At the end of the day, they're our clients, and we need to have services and a workforce that is reflective of our patient population. And we're able to support our patients in the needs and expectations that they have when they come through our doors. Secondly of all, it's really through our staff population. We need a diverse workforce that is reflective of our patient population. And I can say today confidently that our staff population is reflective of that based on our recent staff demographic survey that we did. And it's really not just about representation or a reflection of that. It's really about harnessing the potential of all of our staff so that they're bringing all of their ideas and innovation to work here and that they're engaged. Thirdly of all, it's also about the kinds of partnerships that you develop. And for us, the diversity program is very much focused on a diverse group of community partners that are really speaking to and are able to connect with our patients and client populations. So our program really takes a real holistic perspective, and it really is enshrined in our vision and in our strategic plan.
It is about creating an atmosphere where not only staff but patients also feel respected, feel valued, and feel that they have the same opportunities as others.
Well, at Hamilton Health Sciences, we'd like to think of ourselves as proudly diverse and with great intentions to be always inclusive. Hamilton is a huge area, of course, with 500,000 folks, but we look after the region as well, and so we are serving large and broad communities around us. The diversity is significant. We are known in Hamilton as a place for many immigrants to come to. I'm not sure if it's just because we're a welcoming community or if there's great opportunities to be had here, but either way, I think we represent a huge, diverse population here in Hamilton.
You have the diversity now in the patient population. You have to kind of match that. If you want to maintain the patient safety, be a patient-centered focused type of organization, healthcare organization, you want to drive the diversity in the workforce as well. And you need that innovation and international experience, and sometimes a cultural and linguistic competence. I had the honor of being asked to lead this project, which is the Internationally Educated Nurse and English as a Second Language Nurse Integration Project here at Hamilton Health Sciences, that is funded by the Ministry of Citizenship and Immigration, the Government of Ontario. We started because of a need to actually help and support these internationally educated nurses that were coming, and on a need for the managers to understand what their role should be in supporting them. This is a big organization. Like, we have about 15,000 staff, physicians and volunteers, and we have about 4,130 nurses in all categories. When I'm looking where these people are coming from, I think we have them from all over the world. So some of them will be primary care nurses within the Hamilton Health Sciences, but obviously we created this community collaboration employment model not only for us, but we help them being hired within the community of Hamilton Health Sciences and outside of Hamilton Health Sciences. So in long-term cares, in public health, in some of the doctors' physician offices, in some of the clinics. So we have them actually in all the provinces right now. I don't think it's one province in Canada that one of our participants is not in there.
We serve a very diverse population here at Sunnybrook. We serve over 1.2 million patients every year. We have over 10,000 staff. Our HR business partners work with our leaders on our talent strategy. And part of that is to help to engage and ensure that we have the right talent and we are attracting the right talent. Back in 2011, 2012, we noticed that there is really a need within Sunnybrook to spread our wings and look for internationally educated professionals. And that was when we created a committee, and that committee specifically focused on how do we integrate internationally educated professionals, how do we attract them, how do we integrate them into the Sunnybrook culture, and what support do we provide to these individuals.
Because of my role at Sunnybrook, I became part of an initiative which was Internationally Educated Health Professionals Committee. So at that time, we had an organizational development expert, and she and I, we collaborated and designed workshops focusing on communication and focusing on understanding the feedback. And the difference about that workshop was because we were not just talking about communication and feedback in a Canadian context, but what is the impact of culture on it?
When we attract internationally educated professionals to the Sunnybrook family, it's really important that our leaders are equipped to help with the transition. And so we have created a leader's guide on attracting internationally educated professionals to help our leaders be better equipped to help to integrate our new talent. Our goal is about inclusiveness, it's about integration, it's about respect, and all of our programs are built on that. In creating an environment where we attract internationally educated health professionals, it really gives us another opportunity to leverage the skills that they bring to us, leverage their ideas, their new ideas that they will bring to us. And so it's about tapping into that other part of thinking that brings and helps to integrate into the Sunnybrook culture.
So I think we can build on their strengths, and of course we want to integrate them so that they can reach their full potential in this new healthcare context. But we need to respect what they're bringing, their knowledge, their skills, also the culture piece. It may be the dress or the food, or it may be a language, but it can impact our organization to work better.
This hospital, this organization couldn't function without IHPs. There are rare departments that haven't had successful recruitment of an IHP and haven't benefited from it. There's a whole bunch of moving parts. I can imagine we're amongst the most complex organizations with respect to hiring, and then even the hire has some nuances to it. We're remote. I mean, we're certainly not remote as some other northern communities. I mean, there's good highways and good connections, but for some people, it's a bit of a flyer to move up to Sudbury or to move up to northern communities or serve northern communities because it's different than being in Toronto or having the amenities of that cosmopolitan city, and so that's a struggle. And the socioeconomics of our region is such that we have a greater burden of illness. People aren't as highly educated. The incomes aren't as great. We have underserved segments of our population, either because of their remoteness or their history. We look at the Aboriginal community, and we have a higher percentage of Aboriginals in Northern Ontario that require different types of care or care that's culturally sensitive to their needs. And this is a Francophone area, and so there is certainly an asset if they're Francophiles or Francophones and can communicate with some of our patients in their language of choice. The recruits or the hiring that we undergo is complicated. It requires a lot of planning. There are some specialists that are in short supply. And it's also not uncommon that the spouse of that particular specialist may also be a physician, and so it's the coordination of an IHP that requires integration and facilitation between departments and with departments in order to satisfy both members. Often just seeing what's available in the community with regards to that that cultural diversity, and it's surprisingly there are very few northern communities that don't have the same background, and so it's connecting them to those networks. If the core or the large hospital is strong, that creates a network of recruitment for the smaller hospitals. These communities sometimes need to up the ante in terms of what they can do for attraction, whether it's supported office space or recruitment incentives, moving incentives. So it's a bit of a competitive game, but it's understanding what the hospital, what the community can bear.